Hello, Ben, and good evening to you, everyone. Listen, we are inside the building now. The first time today. We've been here since after 11 o'clock this morning. More than 17 women now have received a mammogram on the mobile mammography van here at the parking lot. But I want to tell you, when patients walk into this building here, listen, they will get the waterfall effect. It's cool, it's calming, it's soothing, and it's also a moment for them to experience and reduce that stress level, that anxiety, and just sit back and relax, waiting for their appointments. So the medical director of oncology here tells me that the pandemic actually put the brakes on women getting their mammograms. So many decided to say no, to bypass those mammograms. Not good at all. And he says it's time to get back to business. Dr. Gary Thomas is considered to be one of the top medical oncologists in the country. In the past 30 years, he's seen a lot of changes and breast health medical advances.
Patients are now requiring, in general, less surgery. Used to be mastectomies. Now we're doing a lot more lumpectomies. People are needing less radiation instead of 6 weeks of radiation. Sometimes women only need 4, 5, 6 days of radiation.
Lately, concern clouds his passion. He says because of the pandemic, many people opted not to have their yearly mammogram.
Even now, even though it's sort of lessened up a little bit, so I have patients, some of them haven't had a mammogram in 3 years. I saw a couple of patients this last month. They were already more advanced, stage 2, stage 3, the lymph nodes are involved. Those patients unfortunately need chemotherapy generally.
Survival rates are phenomenal these days, but it all goes back to early detection with a mammogram. Dr. Thomas says don't ignore breast problems.
Even men get breast cancer, so everybody should pay attention to their body, do the breast exams. And I had a patient today, 27 years old. She had a lump in her breast. She didn't think it was, she thought it was hormonal, that type thing. And she let it go for 9 months before she did anything about it.
Bottom line, listen to your body.
You'll regret it if you don't have the mammogram, and then 2 or 3 years later, it's extensively metastasized.
And right now, I want to introduce you live on WSAV to Dr. Gary Thomas. Dr. Thomas, thank you so much for sharing all of this important information to women. And as you mentioned in the story, men can get breast cancer too. What can we do to reduce our risk of breast cancer?
Many things, Tina, and thank you for coming and raising this awareness. Our Breast Cancer Awareness Month is normally October, so I'm glad we're getting an early start on it. Mammograms, I think, is the number one key. Many women, as we said earlier in the lead-up, did not get their mammograms during COVID-19. So I think if people can redouble their efforts to get back on track with the screening, the best way to cure cancer is to detect it early. Doesn't matter which cancer it is. Breast cancer in particular, mammograms are very, very important. So I would recommend that anybody watching who maybe did not get the mammogram during the COVID-19, they're overdue, don't delay, contact their healthcare provider and get it scheduled.
And of course, we know that breast cancer can sometimes run in the family. It's really important to know your history.
Totally. Many people know Angelina Jolie, Brad Pitt's ex-wife. She had a BRCA mutation, very high risk of breast cancer in her case. So she was able to learn about that and then was able to have a risk reduction mastectomy, both breasts. So now there's no way she's going to get breast cancer. So if you have a family history, you'd want to know that. Meet with a genetic counselor perhaps. Get your mammograms earlier. If you decide not to have a mastectomy, talk to your doctor.
And one last thing, Dr. Thomas, we talk a lot about early detection. We know it saves lives. What are the chances of having a pretty much normal life if the breast cancer is caught in the early stages?
Very high. I saw several patients today that I treated over 25 years ago, and they're doing great, and they've resumed a normal life. And many times women don't want to have mammograms because they're anxious about what could happen. What could happen if you don't have it is you could get the diagnosis a lot later. So the key is early detection, and many times there might be something wrong and it turns out it's not cancer and you can go back. So I think the key is to get the exams done, get the mammograms, get diagnosed, get your treatment. The treatments, by the way, are getting much better. So in the old days, people would have to have a mastectomy. Most of the time now we could do lumpectomies. Radiation is nothing like it used to be. Vast majority of patients don't need chemotherapy anymore. Hormonal therapy is much more effective. Survival rates are high. We've just got to get it diagnosed early.
All right. Dr. Gary Thomas, thank you so much for being with us this afternoon. We appreciate it. Listen, coming up in the 5:30 half hour, we will give more information on special treatments happening right here at the Bluffton campus of St. Joseph's Candler. We're going to the Infusion Center. Stick around for that.